Hello and welcome to the IMCA Talks podcast. My name is Sean Abramowitz and I represent the Iowa Mental Health Counselors Association. I'm on the board of directors and I am here today with Amber Kerby. Amber is an LMFT in the state of Iowa and one of the few providers who is providing ketamine assisted psychotherapy within the state. And that's kind of the main thing I wanted to talk to you about today, Amber. So I was wondering if we could just start off by just giving a general overview of what is ketamine assisted psychotherapy, and why should ketamine be involved with psychotherapy?
Yeah, that's a lot. That's a lot in one chunk.
Sure.
So, ketamine essentially is a dissociative anesthetic. And what we're doing in the therapy realm is being able to use low to moderate doses. That's what I generally work with in order to create non-ordinary states that people can engage in the therapy process in a totally different way. um, it really creates more of an opening mentally and emotionally. People are able to access memories and traumas in a much softer way. Um, I'm trying to remember the rest of all of all of that question. So help me out here.
Oh yeah. What is ketamine, and what is ketamine assisted psychotherapy, and why should the two be together in your
Yeah, why are we pairing them? I think the primary reason that we're pairing them right now is because it really is the only legal way to work with a psychedelic-like substance in therapy. It's primarily used in IV clinics. You can get an intramuscular shot if you're using higher doses. There's also a sublingual, which is basically a tablet that you put in your mouth, and then of course the nasal spray, esketamine, which is actually FDA approved for mental health. And we're really using it in a way to work with complex trauma, to work with treatment resistant mental health, because what we're seeing is maybe 30% of people are responding to the typical sort of talk therapy and medication routes. And that's a really small number. So it gets very concerning for people who are trying medication after medication after medication, and they're not really seeing any lasting symptom reduction. And I was looking through some of the more recent studies, and the numbers are really astonishing with ketamine. They're talking about anywhere from 50% to 89% of patients going through this type of treatment are seeing a very drastic reduction in symptoms. I
wow.
mean, I can only imagine if 89% of my clients were walking out of my office saying, I feel at least 50% better. I mean, that is phenomenal to me. And so, really, what we're doing, not only with that medicine to kind of create this opening for people to access whatever it is that they're wanting to work through in a different way, but we're pairing it with therapy instead of just relying on the medication to really increase their progress. So in my practice, I'm working with lower to moderate doses. So we're still engaging in a therapeutic conversation. There's still a lot of work that's being done, but I'm finding that my clients are more receptive to the insights that they have. They're more receptive to being able to change their perspective on whatever's coming up for them. And and I think that in itself, when we're pairing a medication with that therapy in real time to create lasting change is phenomenal. It's a huge opportunity for us in the mental health industry to really help our clients in a way that um, that is phenomenal and super effective.
Right. Well, you said a lot there, and there's some things that I wanted to get clarification on and break down. So I think one of early on in your statements, you said something about psychedelics and how ketamine is the only psychedelic like substance that can be used for therapy.
Yeah.
And I'm wondering if you can talk about like what are psychedelics like, and why would we use them in therapy? Like, yeah, why is that
Yeah.
important?
Yeah, great question. And it's definitely coming out more and more in mainstream media through MAPS and Johns Hopkins and NYU. They're really starting to investigate how the use of psychedelics, especially paired with therapy, how that is alleviating symptoms of depression and anxiety and PTSD. So most of the formats of those types of studies pair a number of medicine sessions, we'll say maybe 3, with a number of different therapy sessions that happen in between. Um, and I'm forgetting what the rest of your question is. So typical psychedelics, like the classical ones, are the psilocybin or magic mushrooms, DMT, and then you have your more non-classical, which is where ketamine lies, MDMA, that kind of formulation.
Okay. And what happens? I mean, you've talked about like how people are able to more easily address and
Yeah.
uh, complex issues and be more emotionally open and vulnerable.
Yeah.
I'm wondering what the experience is like for somebody using ketamine or using one of these psychedelics.
Yeah. Each medicine is going to take on a different type of experience, and even having multiple experiences with the same type of medicine can still create a different experience. So when we talk specifically about ketamine, it's dissociative in nature. So generally, people are kind of having a floaty, open, softening sort of sensation. Everyone that I work with so far have talked about just feeling relaxed and feeling peaceful. Their inner system starts to slow down a little bit, so you don't have the racing thoughts and kind of that jumbled mix between the thought processes and heavy emotions and strong urges. So it kind of creates this calming state where people can talk about really difficult things that in the past would flood them emotionally. And then they wouldn't be able to really process and get through what it was they wanted to talk about. And instead, they're able to really see what it is, see what's going on. And interestingly, so many people report even being so much more aware of what's happening in their body. So they'll say, wow, I just talked about something that was really sad. And now I feel this sensation in my body that I didn't really understand existed before. So even though there's this dissociation, there is a greater sense of connection that can happen in people's systems.
Okay. I hear that. I also hear a lot of concerns. Like when I've told people I'm doing this interview, I've heard a lot of concerns about ketamine is it is a drug that some people abuse, and it's illegal for use outside of being prescribed by a doctor. Am I right? And am I
Yeah.
correct in saying that?
Yeah.
Um, so I'm wondering what are the ethical implications for you as a provider in providing ketamine assisted therapy?
Yeah. I think one of the biggest ethical considerations that I had to navigate was partnering with collaborating professionals so I could stay in my own lane. I'm a therapist. I don't have, prescribing authority. The medical aspect of all of this is not in my wheelhouse. This is not what I've trained for. So I rely very heavily on those that I collaborate with to do their jobs well so that I can do my job well. Um,
So who do you,
Ethically,
oh, I'm sorry, I'm wondering who you collaborate with and what that collaboration looks like.
I have a few nurse practitioners that I collaborate with if I am working with a client who has an existing, maybe a doctor that is open to partnering with me. I will work with anyone's existing medical professional, but I do have a couple nurse practitioners that I'll reach out to work with me and a client as well in order to just assess safety and make sure that they're appropriate for that kind of treatment.
So how does it look when somebody has ketamine assisted psychotherapy with you and that doctor present versus just having a doctor or a nurse practitioner?
Yeah. Yeah, we break up the intake in a way that makes sense, I think, for all the professionals involved. It's really hard to get everybody in the same room. So essentially, when I receive a referral, either from another professional or people can self-refer as well, I'll set up an initial meeting with them and basically do a mental health assessment, find out what's going on, see if this is going to be appropriate, and then I send their information to my partnering prescriber, whoever that may be in that moment, if the client doesn't have an existing relationship with someone who feels comfortable prescribing. The client then meets with that prescriber to go through whatever process they need to, and then they come back to me once that's been okayed. So once the prescriber says, yes, this is appropriate, there's no worries, on my end, go ahead. And then we engage in a couple just regular therapy sessions to prepare the client for what this experience is going to be like. I have them come in at least once, if not twice. I know it's tricky for people sometimes to navigate their schedules, but I want them to come in to the office at least once so that they can get a feel for what the environment is like. Because I do the ketamine sessions in person. I know that it's an option for some places to do it online with these lower doses, but that was one of those ethical boundaries that I was really trying to navigate. And I know that I just feel better about having my clients in the same space when they're engaging in such a novel treatment. I want to make sure everyone is safe. And then we will schedule out their ketamine sessions, also ethically, and to keep an eye on any substance use problems. I only do this program for 6 to 8 weeks. And then after a period of time, we'll say a month or so, if people decide that they want to get their name back on the list or talk about doing, some booster sessions, I have conversations with clients as that comes up. But by no means am I trying to create a long-term ketamine assisted therapy relationship. It's not as beneficial. And most of the research indicates that within 3 to 4 sessions, even with these lower doses, that's when people are getting that cumulative effect and they're really noticing the reduction of symptoms. They're engaging in either therapy with me or an outside provider to just continue the shifts that they're already making in that ketamine space, which really helps to capitalize on what their treatment is all about.
That's great. Sounds good. And I know that some people, a lot of people are probably would be asking like, what can go wrong? What are the risks? And how risky is it? Like, how proven is this
Yeah.
as something that's safe and effective?
Yeah. There've been a number of studies out. There are a number of trainings out. Even in Iowa, there are, IV clinics. So with the higher doses, absolutely having medical professionals on site makes all the sense in the world. That's safer. That's more ethical. We want to be able to offer those kinds of treatments and have the right kind of care in place. The doses that I'm working with, though, are so much lower. People are still able to get up and move around. I don't have them drive after session or anything like that. I really try to have people take care of their physical body before and after. The biggest concerns really with ketamine are blood pressure related. So we do take vitals as well before and after ketamine session, just to make sure that physically people are ready for the experience and then they've reached their baseline again, that it's safe for them then to leave. And that's another aspect of why I lean very heavily on the prescribers to do the medical assessments, because they know that my practice is set up in a certain way, and it's really only appropriate for the type of clients that are physically healthy enough to be able to tolerate that kind of jump in blood pressure. And yeah, there've been a couple people that I haven't been able to work with simply because of physical aspects making it, not safe for me or for them. And then we just refer out because the clinics can be very useful in that as well, to have those medical professionals on board.
And you mentioned that there's IV clinics that give higher doses and you give a lower dose. Can you kind of explain the difference between getting a higher dose as opposed to getting a lower dose?
Yeah, it's a very different experience. The higher doses generally take on more of a psychedelic type of experience for a lot of people. It is much more dissociative. Uh, with the higher doses, people aren't usually able to engage in any sort of talk therapy. It's much more of an internal process. And so that, from my point of view, is really appropriate for people who have very, very pervasive, heavy depression symptoms, actively suicidal ideation, where they're just really needing something to shift.
Hmm.
So the higher doses are very effective for that. The lower doses are really a way to access that non-ordinary state and yet still have that awareness of, like, I understand where I am. I know who I am. I know what's going on here. But it just feels a lot more expansive, that they're just able to tackle things that in the past have created a lot of barriers for them to try to get to. So it's really experience, what it is people are looking for in symptoms. What are we actually trying to treat? So the clients that I'm seeing with these lower to moderate doses meet the criteria for anxiety disorders or depression, some OCD, PTSD, but it's not up on the scale so high that I'm sitting there thinking, wow, I have 8 weeks to try to resolve this with someone. I don't know how I'm going to do that. Um, so it's really packaged in a way that I want it to be much more gentle for all of us involved. And so expectations are set in a way that I think sets everyone up for success.
Sounds good. Well, I've asked a lot of questions about ketamine, and I wanted to ask about you personally and what made you get involved with this and kind of take this non-traditional route that we don't see very much, especially in Iowa.
Yeah, yeah. Wow, that's a big question too. Um, I think I think my interest really started around 2019 was when I began to gain an awareness of the movement that was happening with psychedelics and therapy. Um, and then it was really through a training that I signed up for in 2021 through the Integrative Psychiatry Institute in Boulder, Colorado, for a certification in psychedelic assisted therapy. And I remember signing up for it thinking how excited I was to learn about all of these things that were happening, but having no idea what on earth I was going to do with it, living in a state that we're not set up for that.
Mm.
Uh, so it was really through that year that I became more immersed in the research and in the practices and in the networks of people who are legally able to, start practicing with these medicines. That I thought, okay, how do we do this in Iowa? How do we bring more of this? I couldn't ignore the numbers, the effectiveness, thinking, gosh, after like 3 MDMA sessions, we have people who have dealt with PTSD their entire lives, and after 3 medicine sessions, they no longer meet the criteria. I was blown away, and I wanted to be able to give that to people as well. Um, I wanted to be able to offer something new and something novel, something that I saw was effective, legal, it's ethical. So why wouldn't we? Why wouldn't we get it out there and make this an option for people?
Yeah, and can I ask you, you referenced 3 MDMA sessions, and
Mhm.
I have heard that that's part of a study. Is that correct?
Yes, that's one of the formats of their research studies. So they'll do the preparation, they'll do a medicine session, And then they'll do 3 to 4 integration sessions, do a medicine session, more integration. So it's really this beautiful hybrid of being able to utilize the medicines, have the therapeutic support, and then really focus on that integration. Because I think, the healing doesn't just occur with the medicine, no matter what we're using. It's also what we're doing with it then. So how are we integrating it? How are we taking it into ordinary life
Mhm.
and creating the change that we know that we need to make? How do we play out the shift of perspectives that we experience? It takes practice.
What is that? And maybe you could give like an example of like somebody going through an experience with ketamine or a psychedelic, and then going through that integration
Mm-hmm.
period with a therapist or on their own, kind of what that looks like.
Yeah. Let me try to come up with a good example. Um, the way that I typically do it, so if I'm able to do the integration with people in between their ketamine sessions, I've also been trained in internal family systems. And the pairing of those two is phenomenal. So I utilize some of that language in the ketamine sessions as well, as people are kind of exploring what's going on. And then the integration, typically the beginning part of integration is really being able to kind of explore the experience. So if anybody had something visual come up, had a huge insight, wants to talk about a memory and what it was like to be there, we allow space for that. And then we really begin to build on what it was that they came in with and what they want to do with it. Um,
Can
gosh.
can I stop you
Yeah.
there? I'm
Yes.
wondering, like you said, if people have a visual or a huge insight, like
Mhm.
what what kind of visuals or huge insights might people have?
Yeah. I think one of the beautiful aspects of these kinds of medicine, ketamine included, is that it's very experiential. I like to say that it's experiential healing that's happening at that point. It's not just cognitive. You're really engaged and feeling it in a totally different way. So depending on dose and depending on the person, some people are just very visual and they'll get different visuals of nature. So I had one client who talked a lot about a specific tree that kept coming up for them, and it was very impactful. Insights really are phrased in a way that people are actually feeling it. I had a client come in wanting to work through some relationship issues. And this person was finally able to truly experience what it was like to love themselves, not just with the words and understanding, yeah, I need to love myself, but they really found themselves experiencing, okay, that's what it's like. So those kinds of insights, um, big or small, can create dramatic shifts in people's life. So, once people are able to really experience that, take the visual, take the insight, whatever it was that came up with them, and then continue to work on it in the ordinary state, they're taking advantage of the neuroplasticity. Both psychedelics and ketamine have this beautiful way of creating opportunities for neuroplasticity. So it's a little bit easier for us to learn. We're able to make things stick in a different way. So integration, I think, is a greatly important aspect of this work, that people are continuing to work, they're continuing to practice and really bring in things from their experience into their ordinary life.
So it sounds like integration. When you say the word integration, it's like taking like lessons or insights that you may have learned while you were having the experience, and then applying them to, and kind of doing work to apply them, maybe in therapy or maybe outside of therapy. Am I
Yeah.
getting that right?
Yes, absolutely. Yeah. Yeah. It's being able to bridge that experience with, what's really happening in life. And then how do they just bring that in, and how do they practice that? How do they talk about it? How do they learn something new and begin to shift?
And you talked about the visuals and the kind of felt experience that people have, and
Yeah.
I know that there are concerns about scary things happening,
Yeah.
scary like hallucinations or visuals, or felt experiences of fear, or um,
Mhm.
like fear that you can't escape, or what some people might describe as a bad trip.
Yeah.
And I'm wondering how common that is, and what you can do about that.
Yeah, yeah. That's always the interesting part too, working with ketamine. Anyone who knows it as a street drug, one of their first questions is, will I fall into a K-hole? Are you going to be able to get me out of this? Um, so typically with the doses that I'm working with, that really hasn't come up. Even if there have been strong reactions and maybe some fear or hesitations, these lower doses have a tendency to kind of keep that at bay. It's when we're working with the higher doses, it's more dissociative, and it can feel a little bit scarier, especially for anyone who's experiencing that for the first time. It's difficult to navigate. And so I think, even in the bumps that come along in the work that I do with people, I don't like to call it a bad trip, because there's really no good or bad to it. It is. This is the experience. And one of the really neat shifts that we're able to do in psychedelic assisted therapy and ketamine assisted therapy is create more empowerment for our clients to really work with the material that's coming up for them and to be with the things that's coming up with them. So anything, fear, anxiety, worries, hard memories, trauma, anything that's coming up with people, I really try to support them as much as possible. But when it comes down to it, it's really on the client to be able to navigate for themselves. How much is too much? And how do I sit with it, and how long do I sit with it, and what does that even mean, and what happens when I do it like this? So there's some experimentation that happens for clients as well, kind of getting used to what it's like to be in that state. But really anything that comes up is something that we're able to use, because it's there for a reason, and it can be really important.
So when clients are on ketamine, are they able to make those judgments about, like, should I be sitting with this? How long do I sit with it?
Mhm. We talk a lot about that up front, when we can. And very rarely with the doses that I'm working with is it something that's so overwhelming and something that is, concerning for clients. Um, and they're really, I mean, there've been a few moments where maybe clients sit up because they think, wow, I need to sit up here for a moment. I've had a client open her eyes before and say, oh, I just need to make sure we were all still here. And then just kind of going back into the experience. Um, so, so I think, just the way that I already position myself with clients in this space to really empower them to make that call, um, gives them the options. You can do what you need to do in that moment. And I'm here to support.
And I want to ask, like, so you're talking about your experience, with clients has been, that it doesn't it hasn't ever gone off the rails for you and become something harmful, it sounds like.
Right.
Um, uh, I'm wondering, how long have you been doing this, and how long has ketamine, assisted psychotherapy, or ketamine just as something that helps with, these mental health conditions, how long has that been around?
Yeah, that's a great question. I don't know the date actually of when ketamine assisted therapy really started. Um, I've been doing it really, oh gosh, since summer of last year. So, a part of my training was working with higher doses and was discussing and practicing skills for situations where maybe it feels really intense for the client. So I feel like I've got, a baseline for that, but also ethically, I knew that if I was going to work with it in private practice, it really needed to be lower doses, because what you're describing is really happening with higher doses than ketamine, and more so in, the studies in the clinics that are able to use psychedelics, because those experiences are typically much more intense.
And is that common? Is that something that happens frequently where people have uh uh what I you don't like to use the term bad trip, but I think that's kind of colloquially
Yeah,
the most commonly understood term.
absolutely. A hard experience. Yeah. Yeah. I mean, when we think about it, what's the population that's going in, to try these treatments? It's people who are battling and have been battling with some mental health issues and symptoms, that, of course, are going to create discomfort. So it's not uncommon that these things are coming up. Not uncommon at all. And yet there are a lot of studies that point to the effectiveness of people being able to have difficult experiences and also feel like they can get through it, which makes it easier next time, so to speak. Even though, some people may report coming in with some fear, apprehension that things like that could happen again, they still have that knowledge of, okay, if it happens again, I also can get through it. It's also time limited. I also have support. There are also ways for me to kind of manage this,
Yeah, yeah.
which, I mean, let's talk about integration. Heck yes, bring that in.
Is there a potential for things to get worse after a difficult experience on ketamine?
Of course. Yeah, of course. I mean, and I think a lot of that is hinged on what came up during that process. So, I think especially in cases where people aren't getting great support afterwards, maybe they don't have a great social support system, their family doesn't understand, their therapist may not understand. It can create, a lot of unstable sensations of like, okay, well, what's going on here? What is this? What was that? What am I supposed to do with that? These medicines can be very powerful in changing our perception about a lot of things. And if you're not prepared for that, it can create, a ripple effect that's really hard for people to navigate.
What are some things that people who are going to use ketamine would need to understand, and also members of their support system, that it would be good for them to understand, like
Yeah.
specifically a therapist who is working with someone who goes and gets ketamine treatment?
Yes. Oh, I have so many things to say about that. Um, I think the most important thing for anyone to understand is that, it was very risky for that client to try such a novel treatment. And so what we really need to do is just validate and support them, regardless of what maybe our personal opinions are about the treatment. Um, I really try to encourage people, because when they come into my office, they sign a document that says I am not driving home after this, simply because their body's feeling a little bit different. So anyone that is going to be giving them a ride home, I really try to encourage them to just maybe ask for some quiet, some music, especially if it's someone that doesn't really understand everything that's happening. That's not the best opportunity to engage in conversations about, oh, I had this experience, trying to make sense of it. That may not be the most appropriate time. But really for people's family, I think it's support. It's allowing them the space and the time, even after their ketamine session, to journal, to create something, to get out in nature, to drink some water, to eat some good food, just kind of helping them get back to baseline. Um, for therapists, I think it's very, very important that we normalize the work that can be done in non-ordinary states. It's very easy to break out the DSM and find all kinds of things that we can slap on people's records. And that, I think, just does people a huge disservice, especially when your therapist is not supporting the transformation that can happen
So
in a non-ordinary state.
yeah, what kind of things might a therapist encounter with somebody who's in, you're
Mhm.
using the terms like non-ordinary and psychedelic
Yeah.
states, I think interchangeably. I think those kind of mean the same things. Am I right about that?
Yeah, yeah, for the most part. But non-ordinary states are also daydreaming, hypnosis, meditation. It really can factor in a lot. So we, in ketamine assisted therapy, we are achieving the non-ordinary state through the ketamine, but people can go home and meditate and still achieve a non-ordinary state. So when it comes, to therapists, I think, especially when there's a drug involved, we're going to look at substance use, which that's fair. We should always be asking those questions. Um, for some people, depending on the dose and depending on what they have going on, psychedelics and even ketamine can create a mania type of state for people. So it's really important, I think, as therapists, for us to understand exactly what was happening in the treatment, how long this is lasting, before we really, create some documentation around it that maybe not be very supportive of what's happening with that person. What else do they need to be aware of? Yeah, I think those are the top ones, is really just um, normalizing novel treatments, being in tune to at least the research, asking a lot of questions, and helping people to bring in whatever it is that they want to bring into their therapy sessions. So even if I have someone coming in saying, "Oh, I had this dream and I really want to talk about it," okay, let's do it. That's a non-ordinary state. We can still use that.
Okay. Okay. So like the non-ordinary states on ketamine,
Mm-hmm.
especially at the low doses, you would liken to uh maybe like going into a meditative state, or having a daydream, or having a dream, and like
Yeah.
kind of
Yeah.
examining what that means in
Mm-hmm.
therapy.
Yes, yes. With these lower doses, that it really is so much softer. It's just not quite as intense. People aren't coming back talking about some really extreme things that you're going to hear in other cases with higher doses or with different medicines.
Okay, great. um I had a question and I forgot what I was going to ask. Uh, I guess I wanted to ask about, you mentioned internal family systems is something else that you're trained in, and that seems to work well with ketamine assisted psychotherapy. And I was wondering if
Yeah.
you could speak to that.
Yeah. Oh, let's talk about another non-ordinary state. IFS is a lot to do with non-ordinary states. Internal family systems, I think, is really beautiful to pair with CAP or ketamine assisted therapy, um, because it really creates a different understanding of our internal system. It creates space for us to talk about a part of me is feeling depressed, a part of me is feeling anxious, versus I am depressed, I am anxious. So even, in an ordinary therapy session, to be able to use IFS, um, we really assist people in accessing what IFS calls your self energy, which is really more of your core self, so to speak, and understand that you have these parts of your system that are managing and they're protecting, and some are holding on to the junk for us, and others are what we call firefighters, and they're trying to just really distract from anything that might bring up any pain or discomfort for us. Um, so what I'm seeing within the ketamine sessions is that people with this softening and with this openness, they're really able to see these aspects of themselves in the way that we're trying to get done in typical IFS sessions anyway. People are able to feel more compassionate and more curious about these symptoms, these memories, these roles, these habits. Wow, why do I keep doing that? Oh, well, there's a part of me that feels like I always have to do that or else the relationship won't work. Oh, that's interesting. And so to be able to kind of build on that in and out of the ketamine space is a really, really great compliment. And in addition, in IFS, one of the tenets is to go to the parts of us that are holding some of the pain and trauma and really allow them to unburden, to lay down the stuff that they're carrying that they don't need to carry anymore and be reconnected with who we are and with our system. And there's something about that ketamine space, that openness, that expansiveness, that softening, that people really are able to go to those parts of themselves and go through the whole process of laying down the burdens in order to feel more connected to themselves, really, to those parts of themselves. And so as a therapist, it really is I mean, it's a joy to be able to see like, whoa, we just did what here in one session? Oh my goodness, how amazing is that? And then to be able to work with that in integration so that you're still using the same language, you're still using the same experience, so that people are really getting more in tune to all of these parts of themselves and how things can shift and how that connection, can actually occur.
So in general, it sounds like it helps you to access the parts of yourself that would be difficult to access
Yeah,
in ordinary state.
yeah. 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 And I think with just the softening that comes with that medicine too, the parts of us that are usually up and running as protectors and kind of keep us, let's not go there. Let's think about this instead. Those parts tend to soften as well. So that's also an aspect that I try to be very, very aware of in the ketamine session, understanding that some of, my clients' protectors are automatically going to be relaxed to allow us to do this work. But as people are coming back online, as the medicine's starting to wear off, and they're noticing those protectors come back in, it's a great space to be able to honor what they just saw, how they feel about it, what do they want you to know, because there's going to be some concerns like, wait, I just took a nap on the job and you did what? Oh my goodness, I don't know that I love this. So, when big movements like that happen in the ketamine space, I really try to be so intentional about what it's like for that client coming back to the ordinary, noticing what parts of their system are coming back online, and creating as much opportunity for connection so that they can really integrate, so that, parts of themselves don't feel like, oh, you just bypassed me. Can't believe that. Can't believe you would do that.
Well, you mentioned so you're using the term coming back online, and
Yeah.
that makes me wonder what what's the time frame for this experience, and how long does it last, and how long are you there with them?
Yeah, we typically map out 2 to 3 hours. I create a 3 hour chunk in my schedule for whatever may occur. Um, but the format that I'm using is sublingual. So it's like a tablet that you put in your mouth and it dissolves and soaks into the lining of your mouth, essentially. And so you hold that in your mouth for about 15 minutes. And then after that, it takes probably another 10 to 20 minutes, depending on the person, for the medicine to really peak. And then they're going to hang out in that space for roughly 45 minutes. So sometimes people are in my office for an hour and a half, and sometimes people are in my office for 3 hours, just depending on how they metabolize the medicine, what their dose is, um, and also how we're formatting integration. Scheduling wise, it can be really tough to fit a lot of clients in in one week. And so if we have the opportunity to finish up our medicine session and then do more of that integration and help people start piecing things together, then we take advantage of that time.
Okay, great. And you talked about scheduling, and so like a practical logistical thing. I also wanted to ask about billing insurance. Is this something that you can bill insurance for in Iowa?
Nowhere. So ketamine assisted therapy is not a billable service. It's basically being used as an out-of-pocket treatment. So what we are able to do as therapists, though, is bill for the intakes, the preparation, and the integration sessions as well, because all of that can fall in the purview of a typical therapy session. So people are needing to pay out of pocket for the actual ketamine sessions, and you find that anywhere. Sometimes insurance for clinics can offset some of the professional costs of having someone there, but the actual process of the ketamine treatment and of the medicine itself is not covered, which is another reason why I really like using the sublingual format, because it's so much more affordable for people. I know that they're paying out of pocket. So really, depending on the dose and how often they're doing it, typically it's 150 out of pocket for the whole thing, just for the medicine. And so that's a lot easier for people to handle than, the 500 and up for an IV. So, yeah.
So if people just went to a clinic where they just had the IV and didn't have a therapist there, that's not billable to insurance by a nurse or a doctor either, is what I mean.
Right. I think from what I'm seeing, there are some codes that nurses and doctors are able to use for administration and things of that nature, but like the actual treatment itself, esketamine could be covered by some insurances, but there are some requirements that have to be met before that is actually approved by insurance companies as a reimbursement. So that can be tricky for a lot of people too, to try to jump through those hoops. So for me, I thought, well, gosh, we'll just pay a couple bucks out of pocket, do the treatment, bill for time as we need to, and focus on the integration.
Okay. Um, and do you have any idea or thoughts as to why this is not billable by insurance?
I don't think there's enough research out yet. They're working really, really hard on getting research up and running, especially on ketamine, so that it can be an approved treatment. It was very hopeful when they labeled esketamine as a breakthrough treatment for depression. So if we can do it with one format, then the others are not that far behind. So it's really just, I think, for a lot of organizations, documenting.
So it's not billable by insurance, but this is a legal practice to do.
The legal practice, yes. Essentially, what they say is it's used off label.
Okay.
So if you get the box, it's not going to say that this is a substance that's used for mental health, for depression, for anxiety. It's going to tell you exactly what it is. So that's really, I mean, I think that's why we're navigating what we're navigating with ketamine, trying to find what's billable, what's legal, and it's a legal medicine, and really just trying to prove how effective it is.
And you've spoken to some of the research and some of the organizations that are advocating for it. I think you mentioned Johns Hopkins University and MAPS.
Yep, MAPS is big with MDMA. Johns Hopkins does a lot with the psilocybin, NYU. But even, some of the other companies like MindBloom's a very large company, and they're starting to publish more and more of their data. So they're doing more of their studies and being able to show measurements and how much people are improving on, the PHQ-9, and being able to really back up the use of ketamine for symptom alleviation, for improvement in mental health.
And you said ketamine was labeled as a breakthrough treatment.
Esketamine was, yeah, the FDA labeled it as a breakthrough treatment for depression.
Esketamine, what is esketamine as opposed to ketamine?
I think it's just how they format it, but it's essentially a nasal spray. So people will go in, Some clinics, even in Iowa, will use it, and you'll have medical professionals on staff. To my knowledge, there aren't any therapists assisting with it, and it's really more of a medical procedure, but people are going in and they're experiencing ketamine in that format. And a lot of them are able to attempt to get reimbursement from the insurance companies.
Okay, great. Sounds good.
Yeah.
I wanted to ask one more thing. I wanted to ask about the training and the certification involved. You said you went somewhere to an organization in Boulder and
Yeah.
your certification. Could you say
Yeah.
more?
Yeah, there are a lot popping up now, but I chose the Integrative Psychiatry Institute in Boulder, Colorado. Fluence is also a large organization. CIIS has been around for ages. They might have even been the first one to really offer these kinds of trainings in psychedelic assisted therapy and research. So I chose one that was about a year long. I wanted an intensive training program because this was all very new to me, and I wanted to make sure that I knew what was happening. And so within my training, a third of it focused on ketamine, a third of it was on MDMA, and a third of it was on psilocybin. And the format of the training program was live groups. We would do small groups. We would have guest lectures coming in as well. We did a couple different intensive weekends where it was just nonstop education and group format. There was also an experiential component where I was able to go out to their clinic in Boulder, Colorado, and really see how they worked everything, how they did everything. And we had a chance to experience the medicine and also to sit with others who were experiencing it. So sitting as a therapist, sitting as, a support, or what some people would call a witness, just kind of being there to help out. And it was phenomenal. It was a phenomenal training program. I felt very prepared to attempt something totally novel in this state. At this point, I am the only master's level licensed clinician to use ketamine in private practice. There's a psychiatrist who's also utilizing it in her practice, but as of right now, this is totally new for Iowa. So to be able to navigate what that was supposed to look like, where the support was, what the paperwork looks like, what's the legal issues that I need to be aware of. It was a very large learning process, which I know I couldn't have done without having a network of people who were already doing it, who were up and running. I have a number of colleagues in Colorado. Almost every therapist in Colorado works with ketamine. So, I mean, it was a fantastic research for me to be able to touch base with all these different clinics and all these different therapists. How are you doing it? What are you seeing? How did you figure that out? Can you help me out? So I felt very supported in opening this up here in Iowa.
So it sounds like even though it's not used very frequently, or there aren't a lot of providers in Iowa,
Right.
in other states and other parts of the country, there are large networks of people who are providing ketamine assisted psychotherapy.
Yes.
Am I right to say that?
Yes. Yeah. It's very common in a lot of parts of the country. So it's new to Iowa, even though we've had clinics open for a number of years. Having a therapist support the process is totally new and achievable.
Okay. So it's been around in Iowa for a while. It's just the therapy component hasn't been around for very long.
Yes, yes. And I think, the lack of training, before I did my training, if I had clients saying, hey, maybe I'm going to seek some ketamine, I would have been like, okay, tell me how that goes. Because I wouldn't have known where to start and what that meant and what it was like and how to be involved or not be involved because I'm just a therapist and that's going to happen something, somewhere else. So I think it's new here, even in Iowa, because so many of us don't really have an understanding. We don't have the training for it yet. It's still kind of up and coming here. But it's, the interest is there. I have a waiting list that extends at least 6 months for people who want this kind of treatment. So we do have a population here in Iowa that could certainly use it and that are very interested in it.
Well, I wanted to give you the chance before we end this by to say anything that you think is important to say about ketamine assisted psychotherapy.
Yeah. Oh boy. I think I've said a lot. I think my top priority is really being able to network and connect to other therapists about what this training and what this type of therapy is about. Um, so I would love for anyone to reach out who's curious, who's a little bit interested, who's confused, who has concerns, like bring it on. I want to be able to start talking about ketamine assisted therapy in Iowa and really how important it is to have therapists involved. I just heard too much about some of the things that are happening in clinics and their medical facilities. So I'm not holding anything against them, but it's really just perpetuating this Western system that we have of, can I just pop a pill and reduce my symptoms and then go about my business? And when we're talking about treatment resistant mental health conditions, it's not just about the medication. There really has to be some solid therapeutic support because things have to shift in people's lives. So if we're not engaging in therapy with these kinds of medicines that have a potential to be very curative for people, then what on earth are we doing? Is it really going to help? Are we not creating a revolving door for people to just go back and get treatment, but not actually work on what it is that they really know they need to work on in order to actually resolve the symptoms? So this is, I think, a huge opportunity in Iowa and for therapists in Iowa to get involved in some way, to begin to normalize this, to begin to create pathways for their clients that they think, oh my gosh, I've been working with them for like 10 years and we're still talking about the same thing. Something else needs to shift. So how do we support our clients? How do we really give them a pathway for lasting change? And how do we become a part of that? And it's feasible.
Great. Well, I thank you, Amber, and I appreciate you taking the time to do this interview.
Sure thing. Thank you so much for inviting me. I can only imagine all the things that have been said during this time. So yeah, just a reminder, goodness, I really welcome people to reach out, get clarification. Let's have conversations. You can probably tell I'm very passionate about this. I really like to talk about it. So I welcome anybody.
Okay, and where can we find you if we want to reach out?
Yeah, the easiest way is probably to get my information off my website, which is just my name, Amber Kerby, KERBY.com, and then you'll have access to all my contact information.
Okay, great. Well, thank you, Amber.
Yeah, thank you, Sean.